नमस्ते बेटिया, हमेशा खुश रहो बेटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH-FHS-Psychiatric University, Jain. In today's lecture, we are going to discuss about various cognition neuropsychiatric assessment. Whenever a patient of psychiatric disorder is coming to us, how can we do the cognition of a neuropsychiatric assessment? This we are going to discuss today. This is basically a clinical lecture. So we are going to discuss how to assess the case of neuropsychiatric patient. Cognition or higher mental function are important part of the MMS. Their significant disturbance commonly points out to the presence of organic psychiatric disorder. So if there is a disturbance in the cognitive or higher mental functions, it represents the presence of inorganic psychiatric disorder. The first one is the consciousness. The intensity of stimulation needs to arouse the patient should be indicated to demonstrate the level of alertness. Example, by calling the patient's name in a normal voice and calling in a loud voice. Light touch on the arm, vigorous shaking of the arm, or painful stimulus. Grade the level of consciousness. So to check for the consciousness, you have to call the name of the patient to check for the level of alertness, normal voice, loud voice. Then you have to touch the arm, vigorous shaking of the arm, or painful stimulus to check the level of consciousness. Next, we will do the orientation. In the orientation, we will check whether the patient is well oriented. Time. Test by asking the time, date, day, month, year, season, and time spent in the hospital. So to check for the orientation, we have to check inquire from the patient about the day, time, and since the time he's in the hospital. The place by asking the patient's location, building, and the city. And person by asking the patient his own name, and he can identify the people around him and the role in the setting. The next step is to check the attention level. Is the attention easily aroused and sustained? Ask the patient to repeat the digits forwards and backwards. Digit span test, digit forward and backward test, one at a time. Example, patient may be able to repeat 5 digits forward and 3 digits backward. So to check the attention of the patient. Next is the checking of concentration of the patient. Can a patient concentrate? Is he easily distractible? Ask the subtract serial 7s from 100. That is, ask the patient to speak the answer for 100 minus 7, or series 3 from 40. That is 40 minus 3. What is the answer? Or to count backward from 20. This is the level test to check for the concentration level. Then you can check for the memory of the patient. Immediately retention and recall, that is IR and R. Recent memory, the events of the recent memory, the events of the remote memory has to be checked for. Check for the intelligence level, that is intelligence is the ability to think logically, act rationally, and deal effectively with the environment. You also have to check for the abstract thinking. Abstract thinking is characterized by the ability to assume a mental set voluntarily shift from one aspect of a situation to another. Keep in mind simultaneously the various aspects of situation. Grasp the essentials of whole, example, situation or a concept, and to break whole into its parts. So this was all about the cognition, checking the cognition of a neuropsychiatric assessment in case of a psychiatric disorder. In the next lecture, we are going to discuss about the investigation, various investigations that have to be conducted in the case of psychiatric disorder. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH-FHS-Psychiatric University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.